Well, welcome to Ask an MS Expert Veterans Program. My name is Emily Riley, and I'm the moderator for this wonderful program. I'm a proud Air Force wife, dog mom, certified personal trainer who teaches adaptive fitness classes for the MS community, and I've been living with MS for over 18 years. I'm currently located at Scott Air Force Base. Thank you for joining us. The National MS Society is committed to offering a place to connect and ask questions to MS experts on topics impacting veterans affected by MS. MS navigators are online throughout the program, answering questions and providing resources, so please post any questions or comments that you may have in the comments box on Facebook, YouTube, or Twitch. I would like to acknowledge that today's program is brought to you in partnership with the Veterans Affairs Multiple Sclerosis Centers of Excellence, the Paralyzed Veterans of America, and the National MS Society. Multiple sclerosis is associated with a wide range of symptoms, and a common one is impaired mobility. Because of mobility challenges and other symptoms, people with MS may be at an increased risk for falls and fall-related injuries. Enhancing a person's ability to walk comfortably and safely while preventing falls is critical. Dr. Suma Shah and Dr. Mark Maniago will join us today to talk about why people with MS have an increased risk of falling. They will share tips and tools to prevent falls, help keep you safe and more independent. We will also talk about fall prevention resources and programs specifically for veterans. So let's meet our experts. Dr. Suma Shah is a fellowship-trained MS specialist and associate professor of neurology at Duke University School of Medicine. She serves as the Associate Director of Clinical Care at Veterans Affairs MS Centers of Excellence East. She is the Director of the Regional MS Center of Excellence for the Durham VA, and Dr. Shah is the Director of the Duke Neurology Residency Program. Dr. Mark Maniago is an assistant professor in the physical therapy program at the University of Colorado Anschutz Medical Campus. He specializes in neurologic physical therapy. Dr. Maniago's research investigates targeted exercise interventions in people with multiple sclerosis and other neurologic conditions. So first, I would like to ask Dr. Shah to join me on camera. Thanks so much for being here today.
Thank you so much for having me, Emily. I'm so glad to be here to discuss this topic and answer some questions that might help improve the lives and care for our veterans.
Love it. So we're going to kind of first focus on why falls occur. So my first question for you is to just kind of tell us a little bit why people living with MS are at an increased risk for falling.
You sort of alluded to this earlier. Multiple sclerosis can affect how bodies work in so many ways. And in those many ways, the impact upon someone's balance, their mobility, their depth perception and vision, all of those things can impact their risk for falls. I often tell my patients that there are 5 things that contribute to them being upright and safe. I talk about strength. I talk about vision and again, depth perception. I talk about that balance, coordination, that's the cerebellum, the spinal cord. And then I also discuss, of course, things like spasticity, tightness, the ability to use a limb, an arm or a leg that helps our bodies know where they are in space. And if any one of those things is not working at 100%, that certainly impacts a person's risk for falls.
Sure. You kind of talked a little bit about it, but we can kind of dive deeper. What are some of the factors that can lead to falls?
Well, if someone is living with any number of symptoms that come from MS, whether it's weakness, decreased mobility, balance, having had optic neuritis in the past and having diminished vision, or spasticity from prior spinal cord involvement of the MS, all of those things can change how a body will move in space. And as a result of that, can lead to falls. There's also the invisible things that we talk about with MS and the symptoms of MS that our veterans may be living with that we can't always tell just by looking at them. And those are things like cognition and being able to have a quick enough response time to catch a body, or things like fatigue that can keep a person from being able to be up and going safely for a long amount of time.
Yeah. Now, I know being at risk of falls can have like a significant impact on a person's life. So tell us, how common are falls amongst people with MS, and why is it important that people learn about fall prevention?
So common. I think probably more common than our science even reflects.
Hmm.
There's some recent data that shares that middle-aged to older adults who are living with MS fall on average once every 6 months. But those are the falls we measure. And I think that there's a lot more near falls or almost falls or, oh, I caught myself and I didn't really end up hitting the ground falls that don't get counted in those measures. And so I do think it's far more frequent than even our measurements say.
Yeah, I know when I go into neurology appointments, they always ask me, like, have you fallen recently? So I'm sure you're trying to capture that kind of data as much as possible.
Yes, for sure.
So we heard from Jerry, who's having balance issues, and he thinks that using an assistive device is giving in to MS. So what kind of advice do you have for Jerry and others who are reluctant to consider using a mobility device?
That story hit close to home. I have this conversation all too frequently.
Mhm.
And particularly as I care for our veterans who are living with MS, there's so much pride in how you go about your day that has to be calibrated with what a body needs to get around safely. And so I frequently use the phrase of going with grace and sort of allowing your body the space and the tools that it needs to get through things safely. And part of that is partnering with your care provider, care team, right? Making sure that you're having these discussions as a person living with MS or a caregiver of someone living with MS of, hey, I've noticed this, or sometimes the feet catch. What do I do about that? How do we help give our patients the tools that they need to stay upright? And of course, the goal long term is to stay off the ground. And we know that there can be so much more damage done long term if someone, you know, hopefully not, but breaks a hip or breaks a bone and the challenges thereof of recovering from something like that. And so these falls are such a big cause of future troubles that everything we can do to prevent them is sort of the right answer. And so giving that look at that conversation at what does my body need right now? And though it may be a huge pill to swallow when it comes to pride, it may pay dividends later if you're doing it.
Yeah, I love your phrase going with grace. I think that's a really helpful thing to remember. While walking difficulties can be one of the most common risk factors for falling, there are other MS symptoms that can be risk factors as well. And I think you talked a little bit about them, but can you tell us some of those and maybe some strategies for reducing the risk of falls?
Yeah, I think it's really important to highlight that walking isn't everything when it comes to falls, and there's so much else that goes on. One of my recent conversations I've been having with a patient of mine is his spasticity, and that's a little bit different than direct linear correlation with walking, where he notices that after a certain amount of time being up and around is when things start to get tighter or they catch. Or knowing he has recognized other patients of mine have told me that knowing, yes, I can go for a 1 mile walk, but gosh, if I push it to a mile and a half, or if I'm out there in the heat for 20 to 30 minutes, that's enough. I'm going to be far weaker. And so to answer your question, there's just so much outside of walking, there's also the environment. There are the other symptoms that can come on with exertion. And then as I alluded to earlier, there's the balance center, which is a complex center in the brain, not just the cerebellum, but the spinal cord that carries all of the body sensations of where it is in space up to the brain and says, this is where I am. And if anywhere along that pathway is getting a distortion in that signaling, your body's going to think you're left when you're going right. And that too is going to put people at a higher risk for falls.
So now, are there any medications that can like help with some of these symptoms that are risk factors for falling? And then conversely, are there medications used to manage MS symptoms that or other comorbidities that could increase risk of falls?
I think that's such a good question. So yes, uh, one of the pieces of patient care that we are taught to be very keenly attentive to is that medication list
Mhm.
because it can cause harm, but also potentially add help. And with the symptoms that our patients experience being so diverse, people end up with a diverse list of medications that they're on for each of those things. And so the quick answer is yes to both of those things. For the first, for medications that may improve walking, there has been a medication that's been FDA approved for improving walking speeds in patients living with MS since about 2010 or so, called dalfampridine. It does come with some side effects and some serious risks like of seizure. And so that is a conversation that needs to be discussed uh, in depth with a treating provider. But with that said, it has been shown to improve someone's ability to walk by increasing their walking speed. And so for what it's worth, it is worth a discussion if that is something that folks are noticing to say, hey, I've heard of this. Is this right for me? What would the risks be? And what does it entail to get this to me safely? For most patients, if they choose to start on dalfampridine, I typically recommend at least a 4-week trial to say, let's give your body time to get it into your system and potentially have an impact that we're looking for. And if at the end of 4 weeks things aren't necessarily visibly better, palpably better, then there's no need to stay on a medication that's not helping and could cause harm. On the converse of that, though, gosh, there's a lot of medications that can cause trouble with falls. And this primarily happens because the majority of our patients used in the neurology world for symptom control have that number one side effect of sedation. And so if they're making people move slower, think slower, give them slower reaction times, well, that's really going to stand in the way of someone being able to catch themselves safely if they are in a place that they may fall. And then there's really common medications like gabapentin, which has been around since the 60s, that has a 4% risk of ataxia, which is incoordination or dysfunction in how a person navigates their body in space. And so yeah, it's not common, but it's there. And if you're noticing that you're having an increased risk of falls, one of the first places we should look are the medications and do a very intentional review of, is this doing you good? Could it be doing you harm? Is it absolutely needed?
Yeah. Well, I'm so glad that you kind of mentioned like going to those healthcare providers because we heard from Sonia who gets her healthcare at her local VA, and she's wondering if there's somebody at the VA who can review all the medications she's taking to make sure that they don't have those side effects or interactions that could cause her to fall.
Yeah, in a couple different places. So the easiest access for this kind of service is through the primary care provider's office. And most of our primary care offices, at least I'll speak for the Durham VA, has an embedded clinical pharmacist, a PharmD, who is responsible for ensuring that when medications are prescribed, they're done so in a safe manner. And they also can provide reviews of patients' medication list. It's called medication reconciliation to ensure that the meds that are on the list work well together and also are the ones that a veteran is taking. But there's also two other places this can happen. The first is within an MS specialty clinic, where it's really part of my specialty training to look at someone's medication list as they come in and then put that together with a patient's report of how they've been doing to try to, in my head, screen through, are some of the things that a patient is experiencing related to the medications that I just reviewed with them. And then finally, the pharmacists themselves within the pharmacy department are able to offer that through a navigator program. So I think it's fair to start with the providers you see and talk to them about, hey, I'm worried that the meds might be part of my challenges here. Do you mind taking a look?
Love it. So people with MS typically fall in or around their homes or neighborhoods, usually while doing like basic activities like bathing or preparing meals or walking around in crowded areas. So, what are some ways that people can maybe minimize these risks?
It depends on how they're getting about and what areas we're talking about. But I think it all starts with awareness.
Mm-hmm.
Typically, when I'm hearing about frequent falls or increasing falls in patients, I really lean on my healthcare team members and the physical therapy and occupational therapy departments to consider home safety evaluations, where one of our team members will go out to a veteran's home, take a look at where they're living, take a look at how they're getting around, let's say with a walker at home, ensure that there's no barriers to how that walker fits through doorways. Similarly, if there's one place that falls tend to happen a lot, I have a lot of veterans who tell me it's in the bathroom in close quarters where they don't have much to hold on to. Those are things to be aware of so that we can help arrange for things like grab bars or safety bars that patients can have installed in the home. And then finally, if there are areas of coming in and leaving the house that have steps where that is posing a challenge to navigating the changes in terrain, that might be another place that the VA does have resources to help with home improvement or adding ramps where veterans can ensure that they're safely coming and going from their home.
Great. Yeah, those are really helpful tips. So aside from MS, from symptoms that of MS that can cause falls, there are behavioral risk factors as well. So what are some other things that people need to think about and some behavior changes to reduce the risk of falls?
That's a really good question too. I think the first thing that comes to mind here is deconditioning, right? When it comes to behavior, it's a very frequent adage in neurology that if you don't use it, you lose it. And so you really want to be using it, but also in the right way and in the safest possible way. And so here, if there is deconditioning, particularly in core muscles, in those hip flexors, the muscles that really help the body stay upright against gravity, well, that's going to be an extra barrier. And so that may be something behavioral that a person can work on their own time. Certainly not quick, but with enough motivation and time commitment, I've seen that improve where I've had patients that I've cheered them on as they go from 30 seconds sitting at the edge of the bed upright to a minute to 5 minutes with a
Mm-hmm.
Swedish walker. And so those small gains with enough motivation and cheerleading on the sidelines from their care team can really happen. The other thing I think of when it comes to behavioral challenges is over or under confidence when it comes to getting around your space. And this was sort of alluded to earlier with one of our patient stories, which is the I have this extra layer of thinking I have to take on as a person living with MS of how am I navigating my world? And do I want to be using that walker even though I've been told to do so? Or I'm really scared of falling, so I'm just going to avoid going into certain terrains. And so the right answer is somewhere in between, where you want to be cognizant of where there may be challenges that pose people at a higher risk for falls, but also ensure that you're able to function to the best of your ability. And so there's that right answer between under and overconfidence to ensure that folks aren't ending up avoiding and then getting deconditioned or doing too much when they really shouldn't be and ending up with more falls than they need to be having, which is zero.
Yeah. Yeah. No, definitely. As a fitness professional, I always say like any movement is good movement because that sedentary lifestyle can have so many impacts on you. So I love that that was kind of something you shared.
Yeah.
Well, I really appreciate you, Dr. Shaw, for the information that you shared. It's so important for people with MS to hear these things. We're going to bring you back later in the program to talk more about fall prevention resources specifically for veterans. But I'd like to ask Dr. Maniago to join me now on camera. Thanks so much for being here today. Awesome. Okay, so we've discussed with Dr. Shaw about why falls occur. So now let's talk about preventing falls and falling safely. So completely eliminating falls is really unrealistic, but many falls can be prevented by identifying the risk factors and trying to take steps to minimize or eliminate them. It's also important to learn how to fall safely to prevent injuries. So, Dr. Maniago, you've done a lot of research focused on gait, muscle functionality, and mobility in people with MS. So, what have you found that may be helpful for people to understand about fall prevention?
Yeah, that's a great question. So we have done some work looking at the role of muscle strength and balance to some extent and how it can affect falls. I think most people think about immediately balance or things like coordination or Sen mentioned. And obviously those things are big contributors to falls. Another thing though that can be really important is just muscle strength, and not just muscle strength in the legs. And I think Dr. Shah mentioned this as well, but like core strength as well. And so we've done a lot of work showing that strength in your core is really important for mobility and balance, even for people that are, fully walking to people that are obviously, more confined to a wheelchair. Core strength can be really important. I think there's other things that maybe aren't so obvious that also can contribute to falls. So pain is something that may not be caused always directly by MS, but a lot of people with MS have pain. And especially if you have pain while you're up and walking, it's important to try to address the source of that pain and get some help with pain relief, because that can cause falls. And then another common one that's also not always talked about a lot is if you have any type of urinary urgency or you feel like you need to go to the bathroom a lot, like we see a lot of falls happen in context of rushing to the bathroom or trying to get to the bathroom. And so addressing those problems as well can be helpful.
Yeah. So, how can a physical therapist help someone who is at risk of falling?
Yeah, I mean, I think the thing about physical therapy and why it can be so important is we try to really take a comprehensive evaluation of what might be causing your falls, right? So That'll include evaluating your strength and your mobility and your balance, asking about pain and maybe trying to find the sources of pain, things like that. Um, so we'll do exams, special tests, we'll have surveys and questionnaires, and design an exercise program that hopefully can improve some of those things. And then it's also understanding the context. So, like, what's your living environment like? What is your daily activity like? And making recommendations around that to keep you safe. And then I think also a really important thing, and I know it's come up already, this idea of assisted devices, but we're experts in, deciding what might be appropriate and how to use an assisted device. So those are some of the main ways I would say.
Yeah. So we heard from Julia, who has relapsing remitting MS, and she wonders what kind of exercises she can do to prevent or even minimize her risk of falling.
Yeah, we get this kind of question a lot. Sometimes it's tough to answer without knowing a little more about Julia. But I will say, like, if we think, maybe Julia's up and walking around and mobile, then I think general strengthening of the legs and the core, along with some balance training, could probably be appropriate. But again, this is one of those things where it really is important to try to get that specialized evaluation by a PT. And it doesn't always mean that you have to, go back to PT every week, but just to get an idea of what you might want to be working on, and make it, get the most benefit out of what you're going to try to do.
Sure. Well, and even sometimes meeting with a physical therapist to kind of get like a base evaluation to be able to come back, and see like, where am I? Do I have any deficits or things like that too? So
That's another great point is we do recommend that a lot, is like at least check in with us every year, even
yeah,
if you're not, even if you don't think you're having lots of problems or any problems, just to get that baseline. And then if you do start having problems, we can have something to compare it to. That's a great.
exactly. Yeah. Okay. So now we've got Sam, and he has progressive MS and primarily uses a wheelchair for mobility. So he worries about falling while transferring out of his wheelchair, and is hoping to learn some independent exercises to strengthen his core. So, what kind of exercises or modifications would you recommend for someone with more progressed MS?
Yeah, another good question. I mean, I think he's right. Sam's right to think that probably core strengthening would be really important for a task like a transfer or sit to stand or something. And so, that could be, again, kind of depending on how good his core balance is and activation. It could be something as simple. I think Dr. Charles mentioned this, like practicing balance for, a certain amount of time and really trying to push the limits, or practicing upright balance, but then practicing, kind of side to side leans and recovering back to the midline. Um, or you could, if you can lay down on a mat and do more traditional core work like a Pilates sit-ups or planks or bridges and things like that, that can all help strengthen the core. Um, and then I think one of the big things when you can identify, and this is what happens a lot of times in physical therapy, is we can identify a task that is particularly concerning or difficult for someone, and then we can figure out ways to improve the task. And a lot of times that can just be practicing the task with supervision, so that until you feel more comfortable with it, or modifying the task so that it becomes safer. So in Sam's case, maybe if he's trying to fully stand up every time and pivot and then sit back down and feeling unsafe with that, then maybe, doing a sliding transfer with a board is safer, or just setting up the wheelchair in a safer way could be a good solution. So yeah, lots of things to consider, and I think he's right that modifications can be really important to keep you safe.
Absolutely. So Corey knows that there are like a variety of assisted devices to help prevent falls. So can you explain what some of those ones are and how they work?
Yeah, I mean, there's lots and lots of assisted devices, obviously, but probably the most common are things like canes and maybe the trekking poles or walkers. the big difference is like how I guess stable they are and how many points of contact they'll have with the ground. So with a cane, you obviously just have one point of contact. A cane will be good for it gives you like a little bit of extra orientation to the ground. So especially if like your feet have some sensory loss and you're not feeling the ground that well, a cane is a really good way to give that sensory input to your hand and
Hmm.
helps you stay upright. And so a cane though doesn't give you a lot of physical support. So if you're really weak in the legs, it's hard to really just lean on a cane and walk. And a cane also is something where if you trip and fall, it's pretty hard to use a cane to help yourself recover, right? Because it's only that one point. So then trekking poles or like even two canes or the forearm crutches would give you 2 points of contact with the ground. So it would give you a little more stability. It would give you a little more support if you did start to actually lose your balance. And so you might have a better chance of recovering with those. Um, and then a walker typically, has 4 points of contact. So that's the most stable, probably assisted device with walking. And a lot of them come with, even brakes and seats so you can really support yourself and rest and sit and rest when you're feeling fatigued, which is another, big cause of falls is when people get too fatigued.
Right. Yeah. And sometimes those walking devices actually help conserve energy. So you can kind of keep going maybe a little longer than without them.
Absolutely. Yeah. Yeah.
So this is such an interesting question because I'm wondering the same thing. If Corey wants to know if using an assisted device will make him weaker in the long run.
Yeah, this is my number one. This is one of my number one questions whenever the conversation of assistive devices comes up, and um, I would actually say not no would be like my simple answer,
Mhm.
and of course there's caveats to that. I think, and Dr. Shah mentioned this a little bit, but if you if we feel like you really need an assistive device, so either because you're falling and what that because you're falling or maybe you're not as active as you'd like to be because you're concerned about falling, then the whole point of the assistive device is you're going to be able to walk maybe further or more and all more safely so that you don't risk the fall that really can take you out for a long time. So even if you just sprain an ankle, you could be off that foot for a few weeks, and then your leg really does start to get weaker. Um, or, heaven forbid you fracture a hip or something, then, that could be even more severe. And so it can help prevent that, which is always good. And then if you're up and walking more, even if you are using a cane or a walker, you are going to maintain more strength than if you're sitting more because maybe you're afraid to fall. So I think in both those scenarios, um, if they're used appropriately, then they actually can help you maintain your strength.
Great. So we've talked a little bit about like walkers and canes. There are other mobility devices. So can you explain a little bit what an ankle foot orthoses, also known as an AFO, and functional electrical stimulation, also known as an FES? These devices, like what are these devices and how can they be beneficial for someone living with MS?
Yeah, so a lot of times we'll use both of these devices, so an AFO or FES, most commonly with people that have foot drop. So like you have trouble picking up the toes and kind of bringing the ankle up, flexing the ankle. And usually that you notice that when you're swinging your leg through while you're walking. So your toes will catch, and then that's obviously a big cause of falls. And so an ankle foot orthotic is a brace. The newer ankle foot orthotics now are usually AFOs are made out of carbon fiber, so they're pretty light, and they essentially help support your foot so that it doesn't drop, but they also have a kind of a dynamic component to them. So when you lift your foot up and you're walking, it actually helps pick your toes up and help bring them through. So that's one common way to address foot drop. And then FES is a much more high-tech way to address foot drop. And FES, there's a variety of devices, but it essentially has electrical pads that stimulate the muscle in just below your knee, typically in front of your shin, and that muscle picks up your toes when you walk. So they're designed to stimulate it at the cycle of the gait that you need it. So typically when the foot's swinging through, they'll stimulate and then they'll lift the toes up. So two different ways to kind of get at the same idea of addressing foot drop. And it really just depends, I think, on the person. So that's why another, a good reason to get evaluated by a PT if you have foot drop is to decide which of those might work, or maybe, both of those work and you use them in different scenarios.
Yeah. And I'm sure Dr. Shaw will kind of share some more resources on how somebody may be able to get access to something like that. But really cool. I love how technology is just kind of continuing to allow people to have a quality of life and continue moving.
Yeah. Some of the new FES devices are pretty cool.
Yeah. So Sumi told us that she tripped over a rug in her home, and now she's determined to make her home as safe as possible. So she's wondering, what kind of things should she consider to help eliminate hazards in her home?
Yes, I love that Sumi's thinking about making her home as safe as possible. I was just at my parents' home, who they're elderly, and I was trying to have some of those same conversations with them. So it's not always easy.
Mm-hmm.
Uh, you know, there's a lot of things you can do. I think the most common thing that we see, or at least anecdotally that I hear, are like throw rugs or the edges of rugs, especially when they kind of curl up a little bit or aren't really firmly affixed to the floor. So that's a big one, either getting rid of ones that you don't need or just making sure they're really, kind of stuck to the ground and the edges don't curl up. That's really important. I think, just general clutter, keeping paths clear, especially if you have pets or kids around, making sure toys and things are picked up off the ground. Another place that we commonly see people fall is in the kitchen. So, just keeping the things that you most commonly use all within reach. So you're not having to bend over a lot to get them, or like get on a step stool to get something high up in a cabinet. That's a really dangerous area. And then the other area where it's really dangerous to fall would be the bathroom. And so a lot of times having throw rugs are big there. So making sure that those are safe or not existent. And then having grab bars. So grab bars can be really helpful in the bathroom, so that you fix those to the wall so that you have something firm to hold on to, and benches in the shower, and sitting down to get dressed and those types of things. And then, maybe one other area would be at night. I think a lot of people have more difficulty in low lighting or when it's dark. And so having night lights available, especially, going to the bathroom, is really important.
Yeah, my husband actually puts them underneath our bed that when you step down, lights come on, and it is really helpful.
Wow, that's really fancy. That's great.
Yeah. Okay, so another place that falls are kind of risky are public places. And so they're filled with potential hazards like uneven pavement, or if there's ice or snow or loose gravel, just to name a few. So how can someone prepare themselves to increase safety while they're out and about in the community?
Yeah, I mean, that can be really tricky because there's so many variables, and especially if you're going to a new place. I think, just being aware is the big thing. And kind of the other thing I think when we go out to a new place is you might be worried about the directions or finding it, and then you're paying less attention to, the sidewalk, or maybe you're late for an appointment or rushing to an appointment. So, kind of like slowing down and being aware, maybe getting there early, can be really helpful. The use of assistive devices. So some people will, that's another conversation with assistive devices. Having a cane doesn't mean you have to use the cane every second that you're awake. Maybe you only need it when you're out walking in a sidewalk, just to, make sure that if there's a big crack or a curb that you can get over that. And so using those when appropriate. I like that, when people have like a flashlight or a headlamp in the car, just in case they get out and it's darker, that can be helpful. And then there's attachments you can get for your shoes for those of us who live in colder climates where there could be icy streets. And so you get these little kind of like covers that have little cleats on the bottom that you can put on your shoes or boots, and they give you a lot of good grip. So those would be some ideas.
Great. Okay, so we've talked a little bit about like risk factors for falls and how to minimize those, but what other tips do you have for people to be prepared before a fall actually happens?
Yeah, that's a good question. I think the number one thing is, I mean, having some way to get in touch with someone, especially if you live alone or if you're alone a lot. So, I mean, mostly we all carry our phones on us all the time or our watches. So that isn't as big of an issue as it used to be, but there are still those emergency alert devices where, if you do have a fall, you can just push a button versus making a phone call. Um, and I think Dr. Shaw mentioned this a little bit too, but just paying attention to your fatigue level and the activity that you're about to go do, and just sort of checking in with yourself and kind of deciding if that might be too much and put you at risk for falls. Um, I think a lot of times I feel like people fall when they're trying to do too many things at once. And so, trying to avoid distractions or like a lot of multitasking, if you can. It's not always possible. But like at home, when you're carrying the laundry or, doing things where you have to be balancing a glass while you're walking up the stairs or things like that, there's oftentimes, ways you can adjust that, like by getting a cart for the laundry or by using a water bottle so you're not as concerned about spilling the glass and things like that. Um, and and then I think, in general, like just being prepared by going back to that idea of getting that PT evaluation and making sure you have a brace if you need it, an assist device if you need it, strategies to, improve your fall risk exercises and things like that.
Yeah. Okay, so the scariest feeling is when you're like, oh my gosh, I'm falling. So when a person feels themselves falling, are there any do's or don'ts on how to fall to like minimize injury?
Yeah, I know that was kind of in the title of our little section here. I
Mhm.
I don't honestly tend to focus on that too much. I think it's pretty hard. You hear sort of competing theories on that, like, let your body relax or, kind of protect your head. Or I think it's falls are not something we expect and they happen pretty fast. And so it's pretty hard to react, I think, to a fall to sort of, do something that would be maybe better than, I don't know. It tends to be pretty hard. And so I tend not to focus on that. I do think that fall prevention, although you're right, I think we'll never get to 100% right, but that is the best way to sort of focus our efforts. As an example, we often, especially falling backwards, your first reaction is to stick your hand out behind you, and that can lead to a wrist fracture. And so I have some people that think, well, if I can, maybe ball up or something and prevent that wrist fracture from happening. But then the issue becomes, well, what if you then fall directly on your hip or hit your head? Like your wrist compared to your hip or your head, wouldn't be the worst outcome. So I think it becomes really tough to sort of then also practice that in a safe way.
Sure.
So
Hmm. It seems like a lot to think about, but maybe yeah, like if you're practicing in a safe place with your PT, I'm like, okay, let's pretend like we're falling. I don't know. I guess that depends on each provider.
yeah, I think it probably does. So what I do like, and I think is practicing how you would safely get up from a fall. Um,
Yes. Well, that is a great lead into our final question here. So, if a fall does happen, how a person reacts can cause more injuries than the fall itself. But, like, what suggestions do you have for people to get them back up safely if they fall? Because that is a big concern. Or if you're by yourself and you don't have somebody there, how do you get up?
Yes, and this I think this I definitely do practice regularly with people that, have issues with falls or are concerned about it
Mhm.
or live alone. It's totally normal, like when you have a fall, to just panic, right? And the first thing in your mind is, I want to get up. And so I think, yes, like you say, a lot of re-injury or other complications come when people fall and then immediately start scrambling to get back up. And so I think one thing is just to sort of take a second, do like a little bit of a body check in terms of, am I hurting? Because you also might not feel the pain right away if you twist an ankle or hit your wrist or something. Um, and so checking with your body and sort of making sure, that you don't feel like you have any serious injuries that would cause you to fall as soon as you got right back up.
Mhm.
Another thing that happens when you get back up too quickly is you can just get kind of that head rush feeling and get a bit of dizziness, and that can cause you to fall as well. Um, and then getting up safely. I mean, again, this really does depend on sort of maybe how strong you are and how and when what's sort of nearby you. Some people can, a very typical way that we teach people to get back up is you can kind of roll on, well, or sort of get yourself onto all fours and then come up to kneeling and then sort of one leg at a time, come back up to tall kneeling and then through to standing. And some people can do that without holding on to anything. Other people might need to scoot or crawl over to a wall or a chair or something that can help support them. Um, and then, of course, realistically, some people just can't get up by themselves. And so if that is your scenario, then kind of going back to those preventative things like having that emergency contact nearby,
Right.
making sure you have that walker or assist device that's going to keep you from falling, becomes really important.
Yeah. All these are just so helpful tips. And I think the big message is like awareness of your space and how you're feeling and all those things. So thank you so much, Dr. Maniago, for sharing such helpful information on how to prevent falls, how to fall safely, how to get up safely. So let's bring Dr. Shaw back up on camera. We're going to talk a little bit about programs and resources for veterans with MS. Okay, so the Veterans Health Administration National Center for Patient Safety has championed services and tools to reduce falls and fall-related injuries for a really long time. So, Dr. Shaw, what kind of resources are available for VA at the VA for veterans who may be at increased risk of falling?
So I think within the VA system, the best resource I found is with the National Center for Patient Safety. They have a whole website that we can share here that allows our patients and their caregivers to have access to all sorts of tools. And that really, to me, as an educator, speaks well to acknowledging different types of learners. So there's
Mhm.
handouts with material you can read, there are videos, and then there are websites of various sources with the American Association of Geriatrics and the PT associations, and sort of all of the associations that have taken a lead in trying to help prevent falls and linking to that. One of the things I found was most helpful on the VA resource, the National Center for Patient Safety, was a handout, really outlining a lot of what Dr. Maniago just shared, which was who is at a risk of falls and what to do when you fall. And it is a PDF, it's a three-part brochure, but I think it does a nice job with pictures of really highlighting some of those things that you both have just discussed, which is how to help ensure that you are caring for yourself safely when you find yourself on the floor.
Hmm. Wow. Great. So we learned earlier that seeing a physical therapist can be really helpful in improving balance, preventing falls. So how does a veteran find a physical therapist within the VA?
So typically a referral is needed. That can come either from the primary care providers team or from the multiple sclerosis specialty team. And depending on where a veteran is receiving care, there may even be embedded PT, which is something I'm fortunate enough to have at our MS specialty center. There are quite a few around the nation that have that, where there is a physical therapist who is an expert at caring for patients with MS who shows up to clinic at the same time that I do, so that when patients see me, they also see them. And that really helps limit the back and forth, some of the physical toll that it takes to come and go from these appointments for our vets that are coming from far away. And so certainly something to ask about if that may be an option for you.
Great. All right. So the National MS Society has a lot of fall prevention resources for people with MS. Can you tell us how someone can find those resources?
Yeah, there's quite a few on the National MS Society website. That's the first place I would direct folks to. The first thing that comes to mind is the Free from Falls program. This is an 8-part module that walks patients and people living with MS and their caregivers through what are the facets of being at a high risk for falls and how to help address some of that. And so not only does it do a great job of establishing the foundation of where those risks come from, but also highlighting the tools of how to really help navigate falls and prevent them. Then what I really like about that Free from Falls module section is at the bottom of that page on the left side, there is a balance program that depending on, you might want to talk to your provider about this, but depending on where folks are with their MS, it may be access to a video training system for balance. And it might be worth vetting with a physical therapist that you're seeing, but it may allow you access to something that's a video that you can try to do yourself at home safely, if that's right for you.
Great. Well, thanks for sharing all those resources. I know that they'll be shared below. So now I'm going to bring both of y'all back up on screen. Dr. Shaw and Dr. Maniago, you both shared such valuable information today, and it was so much good information. So if there were 3 things that you want our listeners to take away, what would that be, and what could they act on right now? So I'll start with you, Dr. Shaw. What are your 3 takeaways from today?
Sure. I'm a little biased, but I think the first of my 3 takeaways would be to encourage folks to see their care team regularly. This allows 2 things to happen: a conversation about how things are going at home, but also a clinical check-in about what kind of symptoms a person is contending with and how to help support them. And so making sure that you show up for those at least once yearly, hopefully twice yearly visits with your care team members. The next is that near falls count as falls. And so when you're reporting your falls, think about those times that you may have lost your footing. You may not have ended up on the ground, but sure could have happened. And even if that doesn't get reported in an official way, those are worth bringing up to your care team members to have a discussion of how do I keep this from going further and becoming scarier. And then, as you all just heard me share, there's quite a few resources available to patients living with MS, both within the VA system as well as through the National MS Society. And I think if you don't know where to look, ask your care team members. One of the resources we try to set up with a national MS, with a MS Centers of Excellence at the VA is to ensure that there really is a spoken hub network so that folks who are well aware of the resources can help educate folks who may be newer to the system, and that way patients are getting the care they need.
Love that. All right, Dr. Maniago, what are your 3 takeaways?
My 3 takeaways. So I agree with getting, connected and regularly seeing your care team. But fall prevention specifically, I think definitely getting evaluated by a PT. It's going to be the best person to help you decide about need for assisted device, braces, exercise program, fall prevention strategies and things like that. The second one, which came up when we were chatting earlier, is to think about your home and make your home as safe as possible. So things we talked about earlier, like throw rugs, grab bars, clearing paths, and just trying to keep things as safe as possible. And then also my third point would be in the community, being aware of your surroundings, knowing your limitations, and kind of checking with how you're feeling in that moment, and then just being prepared based on your functional level. So bringing your assistive devices or any other things you need to keep you safe.
Great. And go with grace and be aware. Awesome. Well, thank you so much. We did get a couple of questions, so we'll go ahead and ask you all a few questions. So Dr. Maniago, we heard from Marta. She uses a cane and says that it's not as easy as it looks. So do you have any tips on how to properly and safely use mobility devices like a cane, walking poles, arm crutches, and a walker?
Yeah, that's a great question, and the assistive devices are often not intuitive, and I think that's sometimes why people, they might try them on their own and think, oh, this isn't for me. Um, and so I think, I mean, again, feel like I sound like a broken record a bit, but like going to your PT can be really helpful. And it's probably especially important for something like this because it could be, for Marta, that the cane isn't the best thing for her if she's having trouble using it. And so, it could be that walking poles or crutches or a walker would be a better choice. And I will say that, this tends to be a pretty simple thing. So I don't think she would have to expect that she's going to have to come back over and over again, just to get trained to use an assistive device, but at least getting fitted with the right one and getting a little initial training. And, there's some other additional research that actually is just coming out of the VA about even training people how to use those assistive devices virtually. So there's those options kind of exist as well, and that can be an effective way to do it.
Great. All right, Dr. Shaw, Kathy has MS and osteoporosis and read that osteoporosis causes muscle weakness and can also increase the risk of falls. So are there any special considerations for Kathy?
Couple. So this is a really good question. And it's sort of a chicken and the egg phenomenon where it's a vicious cycle. One can lead to the other, which can lead to the other. And so for Kathy, what I would share are two things. One, I do reach out to our primary care colleagues to partner in patients who have osteoporosis to ensure that they're on the right treatments and they're getting their bone scans in a regular fashion. But the second is in patients who are living with osteoporosis, that's where my advice often is to lean on our physical therapist, but to try to do some more weight-based training, which can help strengthen that bone health as well. We also try to look at, are there supplements such as vitamin D supplementation that can really help give the bones everything they need to stay as strong as possible for as long as possible. But yeah, I think free weights or body weight based training and making sure that the treatments medically are there to help support bone health are on board.
Great. Well, thanks to everyone who submitted comments and questions, and thanks both Dr. Shaw and Dr. Maniago for being with us today. Your expertise has just been so valuable. I'd like to remind everyone that you can connect with an MS navigator via phone and email through the Society's website via chat. For information and resources on MS, visit the Society's website. You'll find research updates and news, self-help groups just for veterans and active duty military. For more ways to get involved and upcoming events near you. You can connect with the National MS Society and others affected by MS via Facebook, Instagram, Twitch, Twitter, YouTube, and LinkedIn. I encourage you all to like, subscribe, or get on the Society's mailing list to continue to receive up-to-date information on MS and updates on upcoming programs. I want to thank Dr. Shaw and Dr. Maniago for sharing their knowledge and for everyone's engagement in today's program. The recording will be made available on the Society's website at www.nationalmssociety.org/MS expert. I want to invite you to join us in June for our next Ask an MS Expert Veterans Program. Lastly, it's important to get your feedback on today's program. You'll see a survey linked to the comments section or in the program description on Facebook, YouTube, and Twitch. Completing the survey makes a difference, and it only takes 1 minute to complete. The information you provide helps continuously improve and shape future segments. Thank you so much for joining us today, and we'll see you soon.